Hello and welcome to Mediolis. Today we're going to be covering the introduction to pathology. Pathology is going to be one of the most important subjects that you learn in medical school, and quite frankly, pathology is the foundation of medicine. Every diagnosis, every treatment plan, every breakthrough in understanding disease is going to start in pathology. Pathology is actually coming from the Greek word pathos and ology. Ology, of course, is the study of, and pathos is suffering. Therefore, it is the study of suffering, and disease is suffering. Before diving in, let's outline what we're going to be covering in the introduction to pathology. By the end of this session, you should be able to define pathology and its role in medicine, identify the major branches of pathology, classify diseases based on their causes, explain key pathological concepts like etiology, pathogenesis, morphology, and clinical significance. You should be able to differentiate between reversible versus irreversible cell injury. And lastly, we should be able to recognize cellular adaptation as a foundation for the next videos. With these objectives in mind, let's get started. So, what is pathology? Pathology is defined as the study of disease, focusing on its causes, which is etiology, mechanisms, which is pathogenesis, and structural changes, which is morphology. I like to add the clinical significance to all of these pathological conditions, especially the high yield ones, because it makes it much easier for you to understand these diseases and it's going to be making it easier for you to make these connections later on in your clinical years. So it's going to be much easier for you then. Also, a lot of the medical school examinations nowadays are becoming more and more clinical based. So you should keep that in mind as well. So let's cover, first of all, etiology. So, what caused the disease? That's the question you want to ask yourself when you're covering etiology, because etiology is the underlying cause of a disease, such as a genetic mutation. An example of a genetic mutation could be cystic fibrosis. Cystic fibrosis is a point mutation. So, in the case of cystic fibrosis, the etiology is going to be this point mutation. In infectious, we can take the most common one, which is TB. So, the etiology is going to be the Mycobacterium tuberculosis, which is the bacteria that causes tuberculosis. All right. For environmental factors, we can take, for example, asbestos, which was used in building until it was discovered that it causes lung disease and causes asbestosis, and that is an environmental factor. Next, we can have pathogenesis. So for pathogenesis, you want to ask yourself, how does it develop? Because pathogenesis is the sequence of events and mechanisms through which a disease develops and progresses. Next, we have morphology. For morphology, you want to ask yourself, what changes does it cause? Because morphology is going to be the structural and microscopic changes in tissues and organs that are caused by the disease. So you can have gross changes, which can be seen by the naked eye, or you can have microscopic changes, which we need a microscope for. And then the clinical significance. So it's the impact of the disease on that patient, including what symptoms, complications, and prognosis, especially for the high yield diseases. So pathology is a very vast field, and that's why we like to divide it into several branches, which focuses each on different aspects of disease. First of all, we like to divide it into general pathology because it deals with the fundamentals of the disease processes. Inflammation, neoplasia, cellular injury, cellular adaptations, all of these are things that can affect any organ in our body, and that's why it is in the general pathology section. Meaning next is going to be the systemic pathology, which are the where we like to look at the diseases that only affect specific organs. For example, diseases that only affect the cardiac system or the ones that only affect the renal system. We can also have other types of classification like anatomical pathology, which is a morphological type of pathology. Histopathology is a type of anatomical pathology because we like to look at the tissues. And usually it's like a biopsy analysis, usually for cancer diagnosis. We can have cytopathology, which we have to study individual cells, and this is usually the one that we use in pap smears for cervical cancer. We can also have forensic pathology, which is going to be the one that we use to identify the cause of death for that specific individual. We can also have the clinical pathology, which is the laboratory medicine. Hematology is a type of clinical pathology in which we try to see if there's anemia or leukemia and any blood disorders. We can also have microbiology, which is where we try to locate TB, sepsis, or the infectious diseases. We can also do clinical chemistry, which is very important because the biochemical analysis, like the liver function test, the renal function test, they can sometimes be, especially if you're in internal medicine, a daily type of test. And we can also have immunopathology, which is where we try to test for autoimmune disorders or hypersensitivity disease. And we can have the molecular pathology, which is the newest type of pathology, and in which we have genetic and biomarker based disease mechanisms, like HER2 in breast cancer and EGFR in lung cancer. So, the role of pathology in medicine. Why is pathology so important? It's because it is the gold standard for diagnosis. For example, tissue biopsies can confirm the presence of a malignancy, and it provides the most definitive diagnosis. And a tissue biopsy can confirm, for example, whether a tumor is benign or malignant, which is very important in treatment planning. It can also guide treatment and prognosis. Many treatments today are going to be tailored based on the pathology findings. For example, in a patient who has breast cancer, if she has, we can test for HER2 because we can have targeted drugs that we know can target this HER2. For example, Herceptin or trastuzumab can be used for targeted therapies. We can have monitoring for disease progression. So we have liver fibrosis and staging in hepatitis. So the way that pathology isn't just about diagnosis, it can also track how the disease is going to be evolving over time. For example, in patients who have chronic hepatitis, they have liver fibrosis, and we can stage it using pathology, and that can help us to assess the severity of the damage, and we can guide treatment accordingly. You can also have advancing molecular medicine, so precision oncology. Uh, Pathology basically plays a very important role in precision medicine, particularly in oncology, because there are certain genetic mutations, like for example the EGFR in lung cancer, can help us determine whether a patient should receive a specific targeted therapy or not. All right. So, for example, how pathology guides a cancer treatment. Let's say a patient is diagnosed with breast cancer and a biopsy is taken and is tested for HER2 expression. If the tumor is HER2 positive, the patient is going to be a candidate for the drug that we said, which is trastuzumab. This specifically is going to be targeting these HER2 receptors and it's going to be improving the outcomes. Without pathology, this level of precision in treatment would not be possible. And so that's why from diagnosis to treatment decisions to disease monitoring, pathology is at the heart of modern medicine. And that's why it can ensure that the patients will receive the most accurate and effective care possible. So the key concepts again in pathology are the four core concepts: etiology, the cause of the disease; pathogenesis, the mechanism of disease development; morphological changes, which are the structural changes in the cells or the tissues; clinical significance, so how the disease presents in the patients. So let's take an example. Something very common is myocardial infarction, a heart attack. So what is the etiology of a myocardial infarction? It is the coronary artery blockage. The pathogenesis, how? We have ischemia, which leads to cell injury, which leads to necrosis. So A leads to B, leads to C. And then we have morphology, which is going to be there is coagulative necrosis. You're going to be covering the different types of cellular injury later on in more detail. And then the clinical features of these patients: they're going to have chest pain, they're going to have troponin elevation, and they're going to have ECG changes. All right, so next we have the classification of diseases. Diseases can come in many different forms, but they're usually broadly classified based on their cause and their mechanism. So let's go through the major categories. You have genetic disorders, can be further divided into hereditary, like sickle cell anemia and cystic fibrosis; chromosomal, like Down syndrome and Turner syndrome; multifactorial, meaning that it's not just genetic based factors, but other factors can come into play. But because there's a lot of genetic factors, we do include it into genetic diseases, like type 2 diabetes and hypertension. Next, we can have the infectious diseases, like bacterial, TB; viral, like HIV/AIDS; parasitic, like malaria. We can also have fungal. Inflammatory, like autoimmune diseases. For example, pneumonia is an acute inflammation, and rheumatoid arthritis is a chronic inflammation. You can also have the autoimmune disorders, and most famously, systemic lupus erythematosus. Next, we can also have the neoplastic diseases, tumors, which is divided into benign and malignant. An example of a benign tumor is liposarcoma. Of malignant tumors like lung carcinomas and leukemias. Also, lipoma has a malignant version, which is known as liposarcoma. Next, we can also have degenerative diseases and metabolic diseases. Degenerative like Alzheimer's and osteoarthritis. Metabolic like diabetes, mellitus, and gout. And lastly, we have the environmental and nutritional diseases like deficiency, like vitamin C deficiency is scurvy, and vitamin D deficiency is rickets. We can also have toxic exposure in the environment, like asbestosis, like we mentioned before, and lead poisoning. So these are the classification of the diseases, but don't think that this is something that's not important. This is actually one of the most important things that you should memorize is the different classifications of diseases, because later on when you go to your clinical years, if you don't memorize this, it's going to be very difficult for you. For example, later on it's going to be more of like the signs and symptoms. So for example, if you're presented with a patient and you take down their signs and symptoms, let's say a 35-year-old female, she presents with joint pain, um, she has joint swelling, she has morning stiffness, malaise and fatigue and a low-grade fever. She has, let's say, weight loss and a rash. So if she has these group of symptoms and you're the one responsible for that patient, you're going to think back about pathology and you're going to remember the classification of diseases. Why? Because it's going to be very helpful when you're writing down your differential diagnosis. So, for example, this patient, the first thing you want to go through is, let's say, it could be an infectious pathology. So you're going to go through all of the, later on when you learn them, of course, the infectious pathologies that can cause these symptoms. For example, it could be a septic arthritis, it could be a viral arthritis, it could be Lyme disease. You can go through, these are the infectious pathologies. Then next, it can also be an inflammatory pathology, like we said here, rheumatoid arthritis, which is a chronic, basically, inflammation. It could be a gout, like we said, metabolic disorder. It could also be an autoimmune pathology. It could be a neoplastic pathology. It could be an environmental problem. It could be because of heavy metal toxicity or an occupational disorder because she uses her hands too much. Either way, when you memorize all of these classification of diseases, it's going to be very easy for you to make a really powerful differential diagnosis for your patients. All right, so now we're going to be covering cellular adaptation. We're going to have a separate video on each cellular adaptation, but here we're just going to be talking about the general concept of cellular adaptation. So cellular adaptation and homeostasis. When a cell faces any stress or injury, it doesn't just sit there and take it, it tries to adapt in different ways in order to survive. So these adaptations can either be physiological or pathological, depending on the situation. Uh, Cells are basically trying to maintain homeostasis, which is a stable internal environment despite any external stressors. When exposed to any mild stress or any changing condition that is not too much, they will adapt through either hypertrophy, hyperplasia, atrophy, or metaplasia. These are all more physiological forms of adaptation, and these all will preserve function. However, if the cell or if the stress exceeds the cell's ability to adapt, or the cell's adaptive capacity, that can lead to cell injury or cell death. And that's going to be disrupting homeostasis and is going to be contributing to disease. So cells are going to be responding to stress and injury through the following adaptive mechanisms. Hypertrophy, which is an increase in cell size. And this is very important because a lot of people confuse between hypertrophy and hyperplasia. Hypertrophy is an increase in cell size only. So if you assume that this is the normal size of a cell, this is an increase in the size. An example of this is cardiac hypertrophy in patients who have hypertension. Next, we have hyperplasia, which is an increase in cell number. For example, like endometrial hyperplasia. As you can see here, there's multiple different cells. The cell size is the same, but there's an increase in the number, and that is the difference between hyperplasia and hypertrophy. Next, we have atrophy, which is the complete opposite of hypertrophy. Atrophy is a decrease in the cell size or function. For example, if a patient has disuse atrophy, so they're going to have muscle atrophy. If they're not using their arms properly or whatever muscle, there's going to be atrophy. It's going to be decreasing in the cell size. so the myocytes of these muscles and the function of these muscles, so they can't use them. For example, if this is the normal cell, it starts to decrease in size, and that is atrophy. Next, we have metaplasia, which is a reversible change in cell type. An example of this is Barrett's esophagus. So, as you know, the lining of the esophagus and the lining of the stomach are completely different. Okay, so usually the lining of the esophagus is normal stratified squamous epithelium, and of course, the stomach is going to be having columnar epithelium. All right. So if a patient has GERD or gastroesophageal reflux disease, that means that the acid in the stomach in its normal environment enters the esophagus, which is an abnormal environment. This becomes an external stressor to the esophageal cells. So these esophageal cells, which are usually stratified squamous epithelium, are going to be turning into intestinal type columnar epithelium. Why? Because this change is going to be making it more functional because it's able to withstand this acid that's entering it, because that is not a normal place for the acid to be. So the thing is about metaplasia is that it is reversible, and that is why it's physiological, even though it can lead to pathology. But because it's reversible, that is all right. So next we can have dysplasia, which is something that we don't like because why? It is precancerous. It refers to a disordered cellular growth and is often seen as a precursor to cancer. Unlike a normal adaptation, dysplasia is characterized by an abnormal cell size, shape, and organization. And that means that they have lost all of the normal control over cell division, and that is why it is precancerous. All right, so cellular injury. We have reversible versus irreversible. We're going to have a separate video that goes into further detail. Here, we're just going to cover the very basics. In the context of the adaptations that we mentioned before, they try to help the cell survive and function, but let's say the stress becomes too much. The cell gives up and the adaptation fails. That's going to lead to what? Cellular injury. So the cells are constantly exposed to stress, and the way that they respond is going to be depending on the severity and the duration of the insult. And there's two possible outcomes. It can become reversible, for example. A reversible injury is usually, if the stress is mild or short lived, it can recover. The cell will recover. The hallmark features of the reversible cell injury is usually cell swelling. So, because there's going to be disruption in the ion balance, the water is going to be entering and into the cell, and the cell is going to be swelling. There can be fatty change that can occur in organs like the liver. You can also have membrane blebs, which means that the cell surface bulges. A great example of reversible injury is going to be hypoxic injury to the myocardium. So before a full-blown infarction happens, the cardiac cell can still recover if the blood flow is restored in time. As for the irreversible injury, the hallmark is membrane damage. So when the damage becomes way too severe, the cell will not be able to recover. It has two possible fates. Number one is necrosis. This is uncontrolled cell death, often due to very severe injury. For example, like we said, in a myocardial infarction, so a heart attack, the prolonged ischemia can lead to coagulative necrosis. This means that the cell loses their structure but remain visible for some time. Next, we can also have apoptosis, which is unlike necrosis. Apoptosis is a highly regulated and programmed form of death, and is very essential in the development, for example, during embryogenesis. Apoptosis can help shape the fingers by removing the excess cells. So, the key takeaway is that cellular injury exists on a spectrum, and mild damage can be reversed, but once a certain threshold is crossed, the cell is kind of lost forever. Finally, inflammation and repair. Inflammation is one of the most important and fundamental processes in the body. It's the body's first response and protects and initiates repair. But inflammation can be sort of like a double-edged sword. It can either lead to healing, or if very persistent, it can lead to fibrosis. Healing versus fibrosis. Fibrosis is not good. It can result in chronic disease, so we don't want that. And that's why inflammation can be either helpful or could be harmful. It's usually divided into acute versus chronic. So all inflammation isn't the same, and it can depend on the trigger and the duration. For example, in acute inflammation, this is usually the immediate response to injury, is very fast and is dominated by neutrophils, the first responders of the immune system. A classic example of this is like a pneumonia, because the neutrophils are going to be flooding the lungs to fight infection. Next, we can have chronic. So, in chronic inflammation, if the injury starts to persist, the acute inflammation is going to transition into a long-term process here. And there's going to be the lymphocytes and the macrophages that are going to be predominant. They take over the neutrophils' work, and they usually lead to tissue destruction and fibrosis. So you can think of tuberculosis, for example, where we have granulomas forming in the body that try to contain the infection. So why does this matter? Let's take pneumonia as an example. When the bacteria they enter the lung, they trigger an inflammatory response, leading to an influx of neutrophils, like we said. And if everything goes well, the infection is cleared and the patient is well, the lung tissue is going to heal. But if the damage is extensive, the inflammation can lead to fibrosis and permanently affects the lung function of this patient. So inflammation is very essential, but when uncontrolled, it can do more harm than good. So understanding its mechanism can be very important in managing diseases, from infections to autoimmune conditions. This wraps up our introduction to pathology, foundation of disease and diagnosis. We covered what pathology is and its major branches, how diseases are classified, the concepts of pathology, and the importance of inflammation and cellular adaptation. And in the next few videos, we're going to be covering the rest of general pathology. So stay tuned, and thank you for listening.